The American Cancer Society estimates that nearly 2 million people in the U.S. will be diagnosed with cancer this year. And that's why Palomar Health's dedicated medical team strives to set the highest standards for personalized cancer care, helping patients navigate their journey from diagnosis through treatment so they can focus on healing. And joining us to talk about the latest advancements in technology and treatments are radiation oncologists Dr. Brian Volpp and Dr. Jonathan Baer. Welcome.
Thank you.
Thank you.
Now, Dr. Volpp, that study that we quoted with the cancer diagnoses crossing that 2 million mark, 4 of those are on the rise and they're easily detectable. Can you tell us more about that?
Well, I think we were seeing during COVID a lot of patients choosing not to go in or not being able to go in to get screened. And so now we're seeing that uptick in prostate and breast, colorectal and cervical cancers. And those 4 really are what we primarily treat at Palomar, Dr. Baer and myself, with either radiation therapy, which is what we specialize in, or chemotherapy or surgery. The benefit of getting screened is that no matter whether you're older or younger, if you're following the guidelines, we can pick cancers up at a much younger or much earlier stage. And in doing that, the cure rates are much higher.
Dr. Baer, talk to us about the Palomar Health Cancer Institute and how you, through an integrated model, collaborate with other radiation oncologists to provide extraordinary patient care.
Dr. Volpp and myself work closely on a daily basis, where each morning we get together and have a morning conference. We talk about each and every patient that's going to be undergoing radiation treatment for that day. In addition to that, we meet routinely with our medical oncologists. We want to ensure that we have a combined, unified approach for each and every patient, making sure that they have the most comprehensive cancer treatment possible. We also have something that we call a tumor board, which is a conference where all the different specialists get together. And that consists of pathologists, radiologists, oncologists, and surgeons. In that process, we make sure that there's a unified treatment plan for each patient moving forward so that we can optimize their particular cancer outcomes, and we ensure that we exceed national standards.
And Dr. Volpp, talk to us about some of the newest technology that you're using to effectively fight cancer.
So Dr. Baer and I are fortunate because we have a lot of technology available to us through the support of the administration at Palomar. Specifically, in the 2 machines that we have called linear accelerators, or LINACs, they both are capable of delivering something called radiosurgery, which is a high precision, high intensity beam of radiation to specific targets in the body. We do a lot of it in lung cancer and for brain tumors. The benefit of that is that it condenses radiation therapy from 6 weeks down to oftentimes 3 to 5 daily treatments. And patients have the convenience of coming in for a much shorter course of therapy. And it's also much more effective and safer to the adjacent tissues.
And Dr. Baer, you offer a highly specialized cutting-edge technology that patients aren't going to find everywhere in San Diego County. Tell us about it.
There's a special procedure for men with prostate cancer, which is called prostate brachytherapy. And the type of brachytherapy I do is actually high-dose rate brachytherapy. Instead of going from the outside to the inside that we normally do with external beam radiation therapy, we're actually able to put the radiation directly inside the patient with a radioactive isotope. It allows us to deliver a very high dose to the tumor, which can effectively kill those tumor cells. And because it's so precise, it also allows us to spare a lot of the surrounding tissue. I can complete the entire treatment in 1 to maybe 2 sessions.
Now, June is National Cancer Survivor Month, and you both work daily to save lives and get that cancer into remission. Is there a special moment or story that really sticks with you in your career?
Well, you know, I've been doing this for 20 years, and I've had fortunately had lots of survivors. One in particular, I treated for prostate cancer a couple years ago, a really nice guy who has a ranch up here in North County. He came back for one of his follow-ups, and we gave him the good results with his lab work, and he was very appreciative, and he came in with something under his arm, and he showed me what it was, and it was basically a painting that he did. He's an artist of some of the horses from his ranch. The whole staff came over and looked at it. We hung it up in the exam room, and it's been there ever since. So it's a really cool thing to see the patients show appreciation for the types of treatments that we can offer, and it puts a lot of things in perspective as a physician as well.
And Dr. Baer?
Absolutely. There was a pediatric case that I had a few years ago, a young boy who was diagnosed with a cancer, who fortunately had a very curable cancer. He happened to be a big fan of naval aviation. And when he found out that I was an F-18 pilot in the Navy for a number of years, he was just super excited to hear about that. I wound up reaching out to some of my friends who are on the Blue Angels, and they were really touched by his story. So each and every one of the Blue Angels signed a picture that was made out to this boy and sent it to me. When I gave it to him and his parents, he was just so excited, and it really warmed my heart to see that this small token really made his day and made a difference in his cancer journey.
And one he'll remember forever.
Absolutely.
Palomar Health provides world-class cancer care closer to home. Find out how they're reimagining cancer care. Learn more at palomarhealth.org. We thank you both for all you do and for taking the time to share these promising advancements in cancer care.
Thank you.
Thank you.
And we thank you for joining us on San Diego Living. We'll see you next time.